Well, the history with in healthcare with wounds has been traditionally that a person would get a wound and then all these products developed, and they may or may not work that we would apply to wounds, but basically the patient would go home, take care of their wound, and really kind of wait till an infection occurred. And then we'd give them antibiotics, and then the infection would go away, but their wound still wasn't healed, and then they would kind of wait until the next infection, and we're talking wounds that could be anywhere from a year old to 20 years old. We've seen them that old that come in to this clinic. But now that is no longer acceptable. Number one, we're here to save limbs, and secondly, we need to look at the underlying cause of why this patient has a wound in the first place, whether it is a disease process, poor circulation, whatever that is. But bottom line is the number one goal is to get the wound healed, and secondly, and for sure, to save the limb that wound is on. So that's kind of what we're here and what we're about at the Advanced Wound Center at St. Francis.
But you have a new tool in the arsenal now?
And we also have what's called HBO, or hyperbaric oxygen therapy. And the chambers here, what this does is that the patient is placed in this. It's the doctor decides the dosage of the 100% oxygen under pressure that the patient receives. And what this does is it helps to bring oxygen to the area of the wound, the tissue, so that the wound can heal. This in the oxygen, extra oxygen also brings along extra blood vessels and that grow into the area so that the wound can heal. This is also used, hyperbaric oxygen is used for those patients that unfortunately do have to have an amputation. And we may put them in the chamber prior to the amputation to get that tissue in the best possible state it can be so that the incision can heal. Or after the amputation occurs, perhaps part of the incision isn't healing as the doctor would like, we can also put them in the chamber and make sure that they have enough oxygenation so that incision can heal.